Hello, good morning, good afternoon, and good evening, wherever you are. Welcome to Black Mental Health Matters. I'm your host, Dr. Sonja Elise Freeman, and today's topic is understanding perinatal and postnatal mental illness, mental disorders. We have two guests today, so excited to meet them. Let me put them on. Miss Tierra Ledette and
Hi.
and I hope that I'm saying her name correctly, Lene Adamson. Welcome, ladies, to the show.
Hi. It's nice to be here.
Hello.
So I'm going to go quickly and share your bios, and then we're going to go right into it. Tierra Ledette is the founder and CEO of Mentally, a mental health and brain education hub offering interactive workshops and e learning and products. Our mission is to bridge the healthcare and general community through education so people are empowered to make proactive choices daily and mitigate the onset of brain illness or disease. She works as a licensed psychological associate at Tabula Rasa Psychology in Houston, Texas, and as a subject matter expert at REHA Inc., a behavioral health measurement-based care company. She has experience working with marginalized communities, birthing perinatal populations, women caregivers, neocognitive disorders, children with learning disabilities, and within criminal legal system. Lene Adamson, MSW, MPH, CD, DNOA, has worked in the social service field for over 15 years. She holds master's degrees in both social work and public health and has taught at the graduate level at the University of Pittsburgh. As her passion for maternal and child health grew throughout her career, she became a certified birth doula and published author. After years of walking in doubt, fear, and holding herself back from accomplishing her dreams, Lene stopped the cycle of madness and birthed Lene Speaks LLC. Wonderful. All right, again, welcome, ladies, to the show. I'm so excited to learn more about understanding perinatal and postnatal mental health. So let's go right into the questions.
Mhm.
I'm going to start with you, Tiara. What is perinatal and postnatal mental health? What is that exactly?
It's really dealing with mental health challenges or possibly a disorder that might arise during or after pregnancy. So, usually after labor and delivery. In some cases, we often group grief and loss in that group as well. So, sometimes if a woman has a miscarriage or a stillborn, or even going through ART, so assisted reproductive technology, if it's not going well, we kind of lump them into grief and loss. Um, so that's kind of what it is. That makes sense.
Miss Lene, did you want to add to that?
No, that was a great definition of what it is. Basically, depression during and or after pregnancy.
Okay, so the next question I'll ask you, Lene, why is what is the difference between perinatal and postnatal?
So, well, it's Linnea.
I'm sorry, thank you,
um,
Linnea.
no, no worries. Um, and the difference basically is just during and or after. So perinatal mental health or perinatal depression is while you're pregnant. So any of those symptoms that you have while you're pregnant, and then postnatal or postpartum depression is shortly after you have the baby. Some people define it as having these symptoms that go beyond 2 weeks after having the baby, because let's be real, after you have a baby or while you're having a baby, your hormones are fluctuating, they're going up and down. You're feeling all these new things, especially if you're a new mom. Like your hormones, your body, everything is changing. So we're definitely going to experience something within those 2 weeks after having a baby. So they like to wait a little bit to give you that diagnosis until after those 2 weeks, um, so that it gives your body and your mind time to adjust. But if you're still feeling like, those quote unquote baby blues, um, it's beyond just the baby blues. It's beyond that. It's um, you can't get off the couch. Um, you don't want to be near your baby. You're having feelings of anxiety. You're overly worried. It goes beyond that. So anything after those 2 weeks where it's prolonged, um, that's what we call postnatal or postpartum depression.
Okay. Tiara, what are some common perinatal mental health conditions or problems? What's some common ones that we may or may not know?
Yeah, so postpartum depression, but also we often see postpartum anxiety, and even OCD. So we actually, and it's very different from regular OCD. Um, Typically, they might see visions or have repetitive thoughts like dropping their baby or being worried they're going to hurt their baby. Um, and then, kind of more rare is psychosis. We only see that. I've only had one patient with recovering from psychosis. Um, we often see also just in terms of symptoms, but something that they kind of experience persistently is dissociation. So, and that's just kind of feeling out of body. I have a lot of patients who talk about like just, especially if they have a history of trauma, they often live in dissociation because birthing a baby, going through labor is a very vulnerable process. And it can bring back a lot of memory. So a lot of times when we have trauma, we dissociate to kind of keep ourselves safe, and feel safe. So a lot of people kind of live in that kind of symptomology just because they're going through something that's brand new and they weren't expecting things to go that way. And we also see a lot of postpartum rage. With men and women. So just having a hard time adjusting, having a hard time getting used to being a parent, feeling angry, um, things like that. Um, Other than that, I would just say in terms of problems, a lot of times I have to work a lot with boundary setting with like other people in their support system around expectations or um, the biggest thing is asking for help, but not necessarily wanting them to be intrusive. So how do we kind of how do we have that village, but kind of on your terms per se? And so we work a lot. I work a lot with people to make sure they're kind of setting boundaries with their family to kind of preserve their relationship.
Would you like to add to that, Lene?
Nope.
Okay. Next question. Why is it important for pregnant women to take care of their maternal mental health? Either one can answer.
I mean, I feel like it's important for all of us to take care of our mental health, but especially when you are um, bringing a person into the world, you want to definitely take that into account. I can speak from experience of if you're already dealing with or you've already battled and are already battling with depression and or anxiety, it's not something that you should wait to experience while you're pregnant. Be proactive, um, because odds are, like I said, as your hormones are going up and down, as you're experiencing all these things, that you might experience depression and or anxiety while you're pregnant. So it's very important to be proactive. So for myself, I've battled depression for many, many years. And so, although I'm doing well right now, if I were to become pregnant, that's something that I would take into consideration. I'm having my therapist, like, on the docket. I know who my therapist is. I know how to contact them. They're ready. I have my tribe, like Tierra was saying. I know who I can have on notice. Like, if you don't hear from me in a week, check in. Like, check in on me, make sure I'm okay. I'm talking to my doctor. I'm saying, hey, is this medication gonna work for me being pregnant, or should I switch medication? So I'm communicating with all those people that are involved in my care, and I'm also making sure that I'm doing things that are preventative, because I know that this might happen, and I don't want to wait until it happens to where it's out of control and I need to then manage it um, before I do something about it. Because a lot of times it gets worse before it gets better, and so we want to make sure that that doesn't happen. So it's very important to not ignore it, like it'll just go away. That's usually not what happens. It doesn't just go away just because you want it to. You really do have to do something about it in order to treat it. And so it's very important because then it can affect your bonding with your child, which is very important for the baby's development. It can affect your relationships with your parent, with the co-parent, your partner, your family. It can affect those relationships, and it can affect your birth experience. And that's something that we don't always think about, but we want that to be a good experience, especially as being a birth doula. Like, there's so many different experiences that women have that are traumatic, and we don't want them feeling a mother feeling anxious or depressed to cause their birth experience not to be a joyful one or the one that they envision. So we kind of want to protect our mothers and not just um, you know have them out there fending for themselves, which I think that a lot of Black women do because of shame and or stigma of not wanting to say anything, because we're supposed to be, this strong Black woman that can handle anything. So we don't really want to say anything. So we want to protect our mothers.
Sierra, did you want to add anything from your
Yeah,
perspective?
one thing I always encourage moms to come to me is, they always say, I'm worried about my baby and I want my baby. Like, I kind of focus more on the child, and I always tell them, well, it starts with you. If you're not taking care of yourself, how is a 3-month old reliant on you going to be able to depend on you? And so I always encourage them to, like, really, really immerse themselves in self-care, whatever that is. That can range from just the bare minimum of, like, making sure you're eating to, setting boundaries. It's a spectrum of what self-care means. And so, I always kind of educate them on, baby development, how it affects your baby's brain, and development. And that's why it's so important to take care of yourself right now. Um, and so typically we kind of get over that hump of, like, okay, like, if I do this right now, I can kind of buffer some of the things I've been worried about. Um, we always kind of do exercise, and we help them, and we even kind of encourage them to grieve, especially if they're a first time parent, because that shock of, like, I can get up and just walk out my house and do whatever I want goes away when you have, a crying baby, or, you have to get up at 2 a.m. with a baby. It's very different. And so we kind of help them come to that realization early on, before it happens. So
That's really interesting. I know I'm a mom. My daughter is she's going to be 25 this month. And I remember when I was pregnant, I didn't know what to feel. I only have one child. So I wasn't sure if I had, something going on with my mind because I never experienced being pregnant before. So my next question is, how often are perinatal assessments given to Black pregnant women that they may need to be assessed if they have this or not, because they don't know if this is the norm of being pregnant or after having a child. Lene, you can answer first.
What I will say is that the the stats say that 1 in 8 women, or 1 in 8 new mothers, will experience postpartum depression. And then with that, the risk for Black women is significantly higher, for women of color. But what they're saying is that Black women are more likely to have it, but they're less likely to receive help. And so when we talk about assessment, it's twofold. Am I revealing that I'm having issues if I go to the doctor? Am I saying something? Am I letting on that I'm having these issues? Because no one can help me if they don't know that I'm having an issue or a problem. And then two, are doctors that are trying to get you in and out and maybe are rushing the process of your care. Um,
Mhm.
am I getting assessed properly? Are they noticing my symptoms? If I say that I'm just tired or I'm just feeling anxious, are they pacifying it as, oh, that's normal? That's normal for all moms, or what you're experiencing is normal. So it's twofold. Am I saying something, and or is the doctor or provider aware of what's going on? Are they paying attention? Because we as women of color don't always present the same as you know women of other races. Let's be honest. Like we don't present the same necessarily. And so we do need to speak up sometimes to get the care that we need, and to say that something's wrong, and also say, I think I do need an assessment, and not be afraid of a diagnosis per se. Um, so that's kind of like my 2 cents on that.
Yeah, that's true, because if you have the diagnosis, then it means you got to deal with it. And a lot of people don't want to deal with the truth and what they have to, as far as their health, especially their mental health. Tiara, did you want to add to that?
Yeah, so one of the things that we hope for is that OBs and even pediatricians will screen, but we know that they don't. So one of the most popular screening tools is called the Edinburgh Postnatal Depression Scale. And sometimes they don't necessarily ask, they just give it to you and have you fill it out and they kind of tell you. Um, I would like to say that all of them do that and they don't.
Mm-hmm.
Um, Also, there's been a fear, especially amongst women of color, that they would be placed in a psychiatric hospital. I've heard that happen a few times where they did speak up and it didn't go well. And that we see that a lot where they're taken from their baby, or their baby's taken from them. So they introduce CPS, even though what the mom is dealing with is, I don't want to say normal, but it's typical within PMADs, what we call PMADs. And so it's not something that is worth being hospitalized over. It's something that we can treat in outpatient therapy. But most of the time, more I guess more medically trained providers don't know that. They don't get trained in these issues, so they don't have the same level of empathy or how do I address this properly. They don't really go through the proper training um, to know like this is okay. This is getting me treated on an outpatient basis. I don't have to hospitalize somebody because they say something.
And why is that? Why isn't there enough training for that?
I mean, I think that speaks to just one, the medical system we have here in America. It's very reactive. And two, I think it's just when we talk about continuing education, it just depends on the provider and what they're interested in. A lot of providers, especially medical doctors, are kind of doing what's easiest to get their CEUs and they kind of move on. They're busy. Um, but I think for the providers that really invest in their patients, they kind of take the extra step to get the education that they need.
Has that grown more since the pandemic, and we've seen so many more mental health issues that has been happening all over the world, all over the country? Has that increased in that sense?
Um, I would say that probably you see more like doctors who are willing to like prescribe medication.
Okay.
Um, but they don't necessarily make it out. They'll tell a patient, "Oh, you should go to therapy." But helping a patient locate resources, which is the biggest thing, I think most people would say like, "Yes, I do need to go to therapy, but I can't afford, self-pay therapy," which is what a lot of therapists do now because we don't want to take on the insurance companies, right? So
Mm,
you do have those that have insurance, but they have a long wait list. So you sit on the wait list for 7 to 10 months. And by then, I mean, you've probably naturally gotten better just with the wax and wane of mental health and how it kind of works at the brain level. You could have gotten better. So at that point, you don't want to go to therapy. But, it's kind of a systemic issue of access to care, um, you know, how it kind of works and the cost of mental health treatment.
mm,
So,
wow. Is there a disproportionate amount of women of color affected by PMI?
I would say yes. So we think it's about 1 in 3. Um, that's just what the latest stats have kind of said, but that's probably not as accurate, to be honest.
Mm,
So,
So, just to add, like in my research in preparation for today, I found similar statistics and similar information. And what I found was that doctors sometimes miss somatic symptoms, which don't always present in white women, which is what a lot of the literature and studies are done with. Um, there, there's a lack of women of color in these research studies. And
okay.
so if you're basing it on who you've studied, sometimes you'll miss what depression looks like in women of color. And what that can look like sometimes is high blood pressure. What that can look like is unexplained body aches, pain, nausea. It's not going to look the same. And so when you add on some of those other realities that women of color face, maybe having a lower income, being a single mother, head of the household, the stressors of that, the stressors of all those different things. When those things are added on together, um, it kind of is like the perfect storm. And so if a doctor is not trained, like Pierre said, to kind of acknowledge or see those other those symptoms that you might have to dig a little bit deeper for, you're going to miss it.
Mm,
And so women of color, like I said, are more likely to have it and less likely to receive treatment for it. Um, that is what, yeah, that's what I found a lot of. And it's sad because I feel like a lot of women of color um, they are, it's like a silent epidemic. They're suffering in silence and nobody knows.
yeah, and I think that speaks to what we have of the crisis of the maternal mortality crisis with Black women too. Like we're just not believed. When we go to a doctor and we say, I'm in pain, this isn't right. I've had a lot of birthing parents or birthing mothers have complications, and the doctors kind of treated them like, oh, it's fine. You'll be in pain, and you just kind of have to deal with it, or they're rushed out the hospital. Um, that has happened particularly during COVID, where they like kind of get them in and out. It's like a revolving door, and nobody thinks to stop and say, okay, let's provide good patient care. Um, to reduce them having to come back with a hemorrhage or something like that. And so the mental health piece, I mean the physical health piece that they are responsible for is gone out the door. So I'm not I often prepare my patients like be prepared for um be prepared for that because it's not going to be what you probably think of when you go to the hospital, if you choose to birth in a hospital.
And I think that's a great point because we a lot of times talk about, Black women are dying in childbirth at rates that are just astronomical. But we also have to take into account that the Black women or the women of color that almost died in childbirth. And so if you almost died, if you had a traumatic experience where nobody listened to you in the labor and delivery, you're in pain or you were in pain, you had a terrible birth experience. If you didn't have depression or anxiety, you might now have it because of what you went through
Mhm.
um, to have this baby. And so that will change the trajectory of your mood for anybody. If you've gone through where now you have pain where you didn't have pain, you experience blood loss, you are now, iron deficient, like those things are now affecting your mental health because of what you've been through, simply being ignored and not listened to. And which is one of the leading reasons why we're dying or almost dying is that is racism and being ignored and not listened to. They did a study on nurses where nurses really believe that women of color have a higher pain tolerance, that we can deal with more pain than women of other races. So if I have a nurse that thinks that, if I have a doctor who's in and out, is not doesn't have the time because they're overworked, doesn't have the time to come see me, and I'm saying I'm in pain, the providers are like, of course you're in pain. You're having a baby. I'm like, no, I'm in pain. Like something is wrong. Are they going to believe me? Are they going to
Mm.
go the extra step or just pacify like she's having a baby? Of course she's in pain. And who's going to stand up for us to say like something's wrong? And so that those things that are happening because I've seen it happen in the labor and delivery room are affecting women's postpartum depression because they've experienced these things and they're left feeling powerless. Like no one listened to me. They've now had a bad birth experience, and now they're left with this beautiful baby. Um, but they've experienced trauma, and some of them are dealing with post traumatic stress disorder from what they experienced from having the baby.
Wow. So interesting. As I was listening to you speak, I was because I was talking to some of my girlfriends how they're saying that they got to advocate for their health. When they go to the doctor, they got to say, "Listen, I'm not feeling well, and I know my body. So could you please check again, or take another test, or do I need to get another second or third opinion from someone else because you're not helping me. I need to be helped." And I was like, wow, that's incredible how I'm hearing more and more stories about that just across the board, whether, you're pregnant or just, just being a woman and getting checked. Um, it's so interesting what you were sharing about that. So is the perinatal distress, is that what, or postpartum distress, is that what that is when they encounter something like that from having birth, those type of situations?
It can be a lot of times. I have a lot of, like I said, I have a lot of patients. They're fine. I mean, they're generally anxious about becoming a parent, or, they have a history of anxiety and depressions. They're like wanting to kind of be monitored, and then they go to the hospital and they have a very bad experience with nurses and doctors. And so, one thing I have taught patients, or we've kind of found this trick, me and a clinical supervisor, is if they come in your room and they kind of say like, okay, they're kind of rushing you through the process. So they're rushing you from kind of natural delivery, which a lot of people still want, to a C-section. We often we'll tell them you need to pray with your family, regardless if you pray or not, and see what their response is. So if their response is like, oh, okay, I'll give you some privacy, we typically know it's not like fire dire, like, like you're not gonna like die in that moment. But if they kind of like, okay, can you pray while we're on the way? Then you can kind of gauge whether or not something serious is going on. A lot of times they won't communicate with you about what's going on or why you need a C-section, or they just kind of like rush you through the process. They don't really communicate like they would in an outpatient setting, or when you go to the doctor and you're asking questions. They don't do some of that. So that's one trick we've taught people, like say that and see kind of what the response is.
Lene,
And just
you
to
have
add,
any?
yeah, I I honestly think that all Black women or women of color should have a birth doula. And for people who don't know what that is, it's just basically someone who is there as emotional, spiritual, sometimes physical support. And a lot of times, people with a good support system or families don't think that they need a doula um, until they experience having one, and they're like, I can't, I don't know how I did that, had a baby without, having a doula. The difference is that a lot of times, auntie so and so, the partner, they want to support. They are there. They have the best intentions um, for you, but they don't really always know what's happening. And they're also tired and also dealing with their own anxieties and fears, and they're going through it as well. And they don't want to see the birthing mother in pain as well. And so they're going through their own situation. And so a lot of times a birth doula is an advocate. And so we're advocating for that mother. We've had a conversation with that mother of what she wants her birth experience to look like. And so I'm standing up for her, what she desires. And so if the nurse comes in and mom's in pain and the nurse comes in, like Sierra says, and doesn't explain, they just took her blood pressure and didn't say anything. I'm at, what was her blood pressure? Is that normal? Okay. Birthing mom, did you understand what she just said? Do you want to talk about that further? Or, like just those little things of making sure mom is heard. And if that person isn't listening, I'm going and getting another nurse. If she needs this, if she's saying like no, something's really wrong, I'm standing up for that mom, because when you think about a woman that's in a hospital bed in pain, she is in her most vulnerable position. She can't all even if she is a strong-willed person that speaks up for herself. In that moment, she's not necessarily going to be able to do that. And so a lot of my doula experience, I haven't had to like, you know, carry a mom or, go through these rough births. It's been me putting, a cold towel on someone's head. It's me just listening. It's me fanning the person and saying, are you okay? How are you feeling? Are you feeling hurt? And that is sometimes the difference between a woman's positive birth experience and a negative experience. And it also is the difference between a woman of color surviving her birth or not having a near death experience and having a better outcome with their mental health afterwards.
Absolutely. So, how can we prevent perinatal and postnatal illness, mental illness? How can we prevent it? We'll start with you, Tiara.
Take care of yourself now. If you can have the coping skills now, and I mean, I always tell people, if you have the bare bone skills that we talk about in therapy, I mean, sure, PMAT has its own set of kind of things around it, of like becoming a parent and what to expect and things like that. But if you can do a lot of the self-care things, taking care of yourself, advocating for yourself, knowing that when you go to the doctor, if you don't have a good experience, you can walk out. Like, it's just like anything else. If you go to a nail salon and you don't like the nail salon or whatever's going on in the nail salon, you get up and you walk out. It's the same way. Um, you can also, ask them to document. Like, and when they typically have to document, I'm refusing to, further test this patient for whatever. They change their mind because if something does happen, that's medical malpractice right there. So finding the little ways to advocate for yourself and take care of yourself are important. I also think just go to therapy. It's not going to kill you. It's not going to hurt you. It's really there to help you discover more about yourself. And it's same thing. You might not vibe with every therapist, but you just have to find the right one for you.
And I
Lene?
would just say, just to add to that, okay, so I don't know if we've really gone through the symptoms of what depression looks like. And it can look like normalcy because we experience these things. The difference is I'm experiencing them for days on end. I can't bounce back from these experiences. So if you've had, like I said, a history of depression or anxiety, you want to be in prevention and not reaction. um, have that therapist. If you've seen a therapist before, kind of let them know, like, I'm pregnant, I just want to have you kind of on call, or can we set up kind of a, just like you have like wellness visits for your pregnancy, or you see a doctor every once in a while for your physical health. See a therapist every once in a while, check in, have a preventative place to kind of catch it before it happens. Some of the other symptoms are if you have a family history of depression or anxiety. Your mama had postpartum depression and know what that looks like. She didn't call it postpartum depression, but she was dragging. She couldn't, connect with her kids. She, grandma had to take care of the baby the first month that the baby was here. Grandma had issues. Uncle so and so has depression, cousin so and so has depression, and it may not look like they may not have a diagnosis, but Uncle so and so is always is drinking because there's this issue that he's not facing. Cousin so and so is always smoking weed because they can't deal with life on a daily basis. So like pay attention to these signs that aren't necessarily they have depression, but there is mental illness. So look up what depression is because you're like when I was older, I realized that some family members may have had bipolar disorder, schizophrenia, depression, and I just thought it was just, oh, crazy Uncle so and so is coming, and not thinking anything of it, or not to say they're crazy, but that's what we call our family members. You know what I mean? Like we're just used
Mhm.
to the way they are, quote unquote. And so, acknowledging when I got older and I learned more about mental illness, I was like, wow, like that person probably had depression. Or that person probably is fighting depression, but they turned to alcohol instead of dealing with issues. And so, knowing what it is before it happens is a great preventative method of preventing um, having, these things because you can nip it in the bud before it gets really, really bad. Another symptom is if you've experienced problems in your relationship, experiencing financial problems. So you have all these things weighing down on you. That can be some of the added stressors, not a symptom, but an added stressor. They're saying that an unplanned pregnancy heightens your risk of having a mental health issue. And a lot of pregnancies are unplanned. Um, and then when you add on what we've just been through with the pandemic of COVID-19, we've already been isolated. We have a lack of social support, a lack of labor support. They weren't allowing anyone to come into the labor room. And so you're having to do these things alone. Um, you know, when a lot of women have babies, everybody comes over, brings food. Grandma's there, auntie's there. If you have a lot of that family support, and the pandemic kind of took that away because everybody couldn't come over, and then you
That's
might
right.
be really anxious about your baby being sick or getting sick, And so you don't have anybody over, and it's very isolating. And so if you notice that you're crying more than usual, like I said, that goes beyond that 2 week time after having the baby, you're still crying
Mm-hmm.
all day, every day. You're very emotional. You cry at the drop of the hat. That goes beyond, those 2 weeks. You can't get off the couch. You're having problems um, connecting with your baby. You're having thoughts of like, I wish I wasn't a mother. I wish the baby would just go away. Um, you might feel shame about having those thoughts and not say anything to anyone. Um, but I would hope that we're making more progress. We now have more clinicians of people of color. So if you're worried about like, well, they won't understand where I'm coming from, they won't, they don't know my life. There are women of color therapists. Um, so I think the the summary is know yourself. If something's wrong, say something. Don't just allow yourself to suffer when you don't have to,
Mm-hmm.
or suffer longer than you have to. And get the help that you need. Like Tara said, it's not going to kill you to talk to someone. It's okay. And you don't have to tell anybody. If you feel like your family's going to disown you for going to a therapist, don't tell them. Go talk to someone. And if you don't like them, find somebody else to talk to. If you need medication, it as well, it's still not going to kill you to try medication to feel better. When I was in grad school, I needed medication, and I talked to a family member about it, and she was like, "Well, isn't there something else that you can do?" I was trying to survive grad school. I was willing to do whatever it took to feel better, and it did help. It did help me feel better. So they are saying talk therapy and or medication together is the best, um, what's most helpful, but everybody's different. And so you could go outside and take a walk every day, and that might be what, like Tiara said, self care. That might be what does it for you. But how do you will yourself to get out and take that walk? And so if you can't even get outside and put on clothes to take that walk, something might be off. And so
Mm-hmm.
acknowledge it, don't ignore it, do something about it, tell someone. Do not allow shame and stigma to stop you from having the best experience in this life that you can have. Again, do not just suffer longer than you need to because you shouldn't have to.
Would you like to add, Tiara?
I would just say that if you have an SMI, what we call serious mental illness, so that's usually bipolar disorder, schizophrenia, schizoaffective disorder, take your medication. Make sure if you're pregnant that your doctor knows that you're pregnant, so that way you can be put on medications that are safe during pregnancy. But it's more important that you're stable at that time during pregnancy than it is to get off your medication. Um, I think that's a very big misconception that, I can't take medication while I'm pregnant. It's not that you can't. In those cases, we actually encourage you to take medication because if, your symptoms get too severe, um, it could lead to some deadly outcomes in terms of suicide or things like that. So it's super important for that population to take their medication as well. And then it also happens with paternal partners or non-birthing partners. So if you're not the birthing person and you're not doing well, speak up for yourself too.
I had another question, and I think you may have answered it, but I'm just going to ask it again just for those may have tuned in or just kind of all together. What is the impact of the Black Superwoman Complex syndrome or the strong Black woman on PMI and a woman's willingness to seek help? We can start with you, Tiara.
I would say um, I've seen this a lot. I've had patients not do well postpartum, but because they have this thing of I have to do it myself, or I can't rely on other people to do it. And so we typically explore where that comes from. Is it, more like I don't like the way they do something, and helping them let go of I need help. It's okay to ask for help. I always tell people this is the one time you get free reign. You can ask your neighbor to get your mail. You can ask whoever to come and like sit and watch your baby while you take a shower, especially if you don't have a doula. It's the one opportunity you get to do that. And I would say majority of the time people want to help, they just don't know how, and they don't want to bombard you sometimes.
Mm-hmm.
Or they bombard you thinking, overwhelming you with text messages and phone calls because they know you probably need help, but they're not going to say like, hey, can I come do this or that? So, sometimes people don't know what to do or what to say, so they just bombard you with, questions or whatever. So, kind of breaking down that and letting them know like you're a person at the end of the day, like you need help. You're one person. We do the pie chart of priorities. Like, um, I often have them draw a pie chart, and I'm like, okay, like what are the things you really need to do for yourself and for your baby? And then what are the other things you do from a day-to-day basis, baby or not? And when you see all of that stuff on the list, start delegating some tasks to people. Like, have somebody come clean up, or, have somebody cook you a meal. Like, it's not going to hurt you. Um, if anything, you being vulnerable is being strong. So being able to ask for help is not something bad.
Lene?
Yeah. So, to add, historically, we've had to be strong. Generationally, we've had to be strong to get through
Mm-hmm.
what we had to get through to survive. And so, if great grandma was strong to get through it, and grandma was strong, and mom was strong, and so we've been that passed down that strength that that has helped us survive. That is not a bad thing, but it also keeps us from asking for help when we need it. It keeps us from admitting when we're not feeling well and we need to talk to someone. And so, because of that generational, like we don't ask for help, what happens in this house stays in this house. Kind of some of those generational things that have
Mm-hmm.
helped us survive, but now aren't necessarily serving us, or
Mm-hmm.
being strong all the time um, can work against us to where we're
Yeah.
burnt out, tired, frustrated, don't know how to deal, but we can't tell anybody because we have to be the strong black woman. Um, that is kind of what we're dealing with. Is wanting to be strong, but seeing asking for help, especially regarding not feeling mentally well, seeing it as a weakness.
Mm-hmm.
I know for myself, when I was in the crux of depression, one of the biggest things I had to deal with was my pride, because I could not understand why I could not help myself.
Mm-hmm.
And I wanted to help myself. I wanted to feel better without medication. I wanted to feel better without a therapist. And it really was frustrating. It probably still is to this day, but it really was frustrating that I could not get better on my own, within my own strength. And so that's one of the things that you have to kind of deal with, especially if you are, a strong willed person and an independent person, but now you need the help of someone else or something else to feel better. And you kind of have to get to that point where, do you want to continue to feel bad because you want to be strong, or do you want to feel better? That's what it comes down to. Do you want to feel the best that you can feel? Because, let's be honest. A lot of times we're running households. We are the strength of families. We are what our kids come to, what our partners come to for strength and for help. But if you are not okay, how are you good to anyone? If
Yeah.
you can't be strong, if your strength is gone because you are literally pouring from an empty cup, you can't help anyone. And so I would hope that a lot of the stigma and the shame is lessening in 2022, because more people of color are getting therapy and getting medication and things like that. We're not ashamed to get be on medication for high blood pressure. We're not ashamed to go to the doctor if our toe hurts, if our leg hurts, if we're having a back issue. We're not ashamed to go get help for these things. So why
Hmm.
are we ashamed to get help when we are feeling overly sad, burnt out, etc.? And so challenging yourself and your mindset and figuring out where did these beliefs come from kind of is a first step to dispelling, like, I don't have to be strong all the time. I Where did that come from? Who says that I can't talk to someone? Um, and so really kind of attacking those mindsets. And therapy really does help. Being
Hmm.
able to talk to someone else that is not in your family, that does not know you, and that can give you a constructive feedback and assistance on how to help yourself, like, the best thing ever. So
Absolutely. Absolutely. We're at the last 7 minutes of the show, ladies. It went by fast. So I'm going to ask each of you to give your final thoughts on understanding perinatal and postnatal mental health. We'll start with you, Tiara.
Yeah, so kind of to just recap, we often call them PMAD, so perinatal mood and anxiety disorders. So postpartum depression, postpartum anxiety, or perinatal and postpartum depression, anxiety, OCD, which looks kind of different than typical OCD, and psychosis. We also see rage, trauma, dissociation kind of pop back up for people who have a history of trauma, especially like sexual assault, things like that. Um, just be very proactive in getting help, um, and be persistent. Um, Therapists are busy. I'm not gonna lie to you. It's interesting to see so many people reaching out for help, and that's encouraging. But if you kind of be persistent, you'll eventually find someone to help you through the process. And even for therapy, one thing I tell people is, sorry, excuse me. I don't force people to talk about what they don't want to talk about yet. And there's other forms of therapy where we don't have to talk. Um, I always encourage people, one thing I've encouraged a lot of people of color to do is find a brain spotting therapist. So, brain spotting is a form of therapy, but you don't have to talk about whatever happens. And it helps process in your limbic system. That's basically where we hold trauma in our brain, to help us survive and stay alive, and when we feel like we're threatened. But we often, especially as people of color, we hold that so close to us, just trying to leave out the door and come back every day, and return home to our families. We're always in hypervigilance and survival mode. So, at best, find a brain spotting therapist. You don't have to talk to them about your problems or anything. You can just process in silence and heal and be transformed. So, that is just one form of therapy that I've found works very well for people of color, and especially for other forms of trauma or groups that might have a lot of stigma around therapy.
and I'll just
Absolutely.
say, don't wait. Um, you know something's wrong. We know ourselves. We know something's wrong.
Hmm.
So don't wait 3 months, 6 months to do something about it. Um, Work in prevention, not reaction. Um, try to prevent it before it happens. If you know that you are susceptible to when hormonal shifts happen at that time of the month, when you have your menstrual cycle, you're off. Most likely a pregnancy will be more dramatic of a shift. Um, so don't ignore it. Be proactive. Do something about it, and don't expect that it's just gonna go away on its own. Prayer is awesome. A lot of women of color, well, I'm just going to pray about it. Just going to go to church, and that's awesome. That's great. But God has also put people in our lives to help us. So let them. Um, and that's my biggest take home thing. Just let someone help you.
Absolutely. And I would say advocate for yourself. Speak up.
Mhm.
That's I think that's a big thing. Black women, we don't speak up for ourselves. We're always helping everybody and their mama, but we don't take the time to speak up for our own selves and our own health. So, advocate for yourself, I would say, to kind of round out what you both have shared. Um, Tiara, can you share your contact information, how they can contact you, um, and if they need your help, your services, and Lene, you the same after her.
Yeah, if you need to contact me, I am at Tabula Rasa Psychology in Houston, Texas. Our phone number is 432-698-0141. Also, a good resource is called Postpartum Support International. They have a helpline, they have a tip line. Um, they can actually locate someone for you. They also have a lot of support groups and just resources, so you can always look at their website as well to get help or get connected to a therapist if you need it.
And I can be reached pretty much on all platforms at Linnea Speaks. And LinneaSpeaks.com, on social media, Linnea Speaks, on LinkedIn, Linnea Adamson. Definitely willing to talk about this subject any day, all day. So definitely, if there's more questions, DM me on LinkedIn, Instagram, etc. I'm just so grateful to have a platform to be able to discuss these sorts of things because they're really important. So thank you.
Absolutely, absolutely. Thank you so much, Tierra Ledette and Lene Adamson, for joining us on Black Mental Health Matters, because it does. We want to thank everyone for watching, and we encourage you to follow us. Follow us on Facebook, Instagram, and our YouTube channel. And if you'd like to sponsor us, we would love to have you. Please contact us so that we can grow and share to more and more people all over the world that Black mental health I can't say that enough. Black mental health matters. Thank you again, ladies. Have a wonderful day. If you're mothers, happy Mother's Day to you. Happy Mother's Day to all who are listening and will listen in the future. And we thank you and enjoy your day.
Thanks.